This is the All About Vision series from the Early Years Project, the eye diagnosis. We use QR codes to direct you to different resources in our videos. In order to use a QR code in a video, pause the video when it appears and then on a different device, open the camera and point it at the QR code like you're taking a picture. A link will pop up, either tap or hold it in order to access the resource. If that doesn't work, you can always try holding the device steady or get closer to the screen. If you want or need to access a QR code from a screenshot, take a screenshot of the QR code when it appears in the video, and then later on you can open your device's photos, click on that picture, and either tap or hold the QR code, and you will be brought to the resource. Categories of eye concerns. There are vision, eye concerns, and in this category, we have refractive and non-refractive. Refractive is when a prescription can provide better vision, and non-refractive is where it won't. But an example of that would be an issue with the eyes communicating to the brain. Refractive issues and medical issues are the most common types of concerns in children, but there are non-refractive issues that I want to bring up as well. Refractive issues like nearsightedness, farsightedness, and astigmatism are most common in children. So myopia, nearsightedness, is a difficulty seeing distant objects clearly. Hyperopia, farsightedness, is difficulty focusing on close objects. And astigmatism is blurred or distorted vision at any distance because the cornea is shaped differently. And that is not something that you would see by looking at them either. It's just the shape of the cornea, and they can tell at the eye exam. But in all of these three, glasses or contact lenses can often correct these. Other types of refractive errors are binocular vision disorders, and this is when the eyes aren't working together as a team. And this includes strabismus or crossed eyes. This is when the eyes are misaligned and they are not looking at the same place at the same time. Convergence insufficiency, when the eyes don't work together when they're focusing on nearby objects. And amblyopia, lazy eye. This is when one eye has reduced vision and it isn't moving with the other one and making it appear lazy. This can actually last into adulthood if it is not treated early. And I just want to take a quick moment to share a graphic on binocular vision disorders. This is just a really nice representation of what they can look like when somebody is experiencing that issue. Common medical eye conditions in children, conjunctivitis or pink eye. This is an inflammation of conjunctiva leading to redness, tearing, and discharge. Bacterial conjunctivitis accounts for over 50% of cases in children. Clogged tear duct. This is a blockage in the tear drainage system causing watery eyes and potential discharge. And it affects up to 20% of newborns and often resolves without needing any kind of medical care. It can also happen in children, but it is much more common in newborns. Stye. This is a red, tender bump on the eyelid caused by a bacterial infection of an oil gland. So typically, you can make this go away with warm compresses, but sometimes antibiotics are needed. Blepharitis. Chronic inflammation of the eyelid margins, and it leads to redness, irritation, and crusting. This usually requires some regular eyelid hygiene and in some cases, antibiotics. Choliason. This is a painless lump on the eyelid resulting from a blocked oil gland. This happens in about 2% of children, but there are higher rates in some ethnic groups. Periorbital or preseptal cellulitis. This is an infection of the eyelid and surrounding skin causing redness and swelling. This is more common in children than adults, and it requires immediate antibiotic treatment. Corneal abrasion. This is a scratch on the eye's surface leading to pain, redness, and light sensitivity. This is a pretty common eye injury in children, and it often results from minor trauma. Non-refractive errors, visual processing disorders. These involve difficulty interpreting visual information even when vision is normal. Children may struggle with tasks like reading, writing, or understanding spatial relationships. Cataracts, either pediatric or congenital. So, pediatric means it comes on at some point in childhood, and congenital means that it was present at birth. So, this is a clouding of the eye's lens, and it is not very common, but I do want to bring it up because it can lead to significant visual impairment if it is not treated quickly. So, some causes of pediatric cataracts include trauma, diabetes, poisoning, steroid use, or other childhood diseases like rheumatoid arthritis or complications from other eye diseases like glaucoma. Right, glaucoma. This is a pediatric or congenital condition again. Remember, either coming on at some point in childhood or was present at birth. And this is a rare eye condition where pressure builds up inside of the child's eye, damaging the optic nerve, which is the part of the eye that sends visual information to the brain. Okay, so here are some pictures to show you what some of these medical eye conditions look like. So cataracts just kind of looks like a strange reflection when you look in the eyes, and glaucoma looks cloudy. And a stye can be either internal or external. I wanted to call a little bit of attention to the cellulitis. So this looks vastly different on different people, depending on the age of the person and where it's presenting. So if this is what you suspect, maybe look it up and just to verify, but this is one that requires care immediately. One of the most important things for families to know after a child is diagnosed with vision differences is that you are not alone. In Illinois, we have support through the Illinois Early Learning Project, the Illinois Service Resource Center, ISRC, and the Illinois School for the Visually Impaired, and many more. We have a lot of other resources listed here on the Early Years Project resource page. Passing a vision screening doesn't mean your child's eyesight is perfect or will stay the same forever. It just means no problems were found at that time. If you have any concerns about your child's development, consider reaching out to your pediatrician, optometrist, early intervention specialist, or developmental pediatrician for support and guidance. Even if your child passes a vision screening, it doesn't mean that an issue won't ever come up. The Early Years Project was brought to you by Illinois EDI, the Early Hearing Detection and Intervention Program, and Illinois Hands and Voices Guide by your side. Please take a moment to take our brief survey. Thank you for watching.